Every time you use that debit card, write a check, or withdraw funds, the balance in your bank account goes down, sometimes too far down.
How many times have you had overdraft charges?
Anywhere between, like 10, 15 times a year.
This man, who's too embarrassed to be identified, has a good job, but not enough income to make it through most months. We're calling him John, which is not his real name.
I make it from paycheck to paycheck.
Do you believe you're part of the working poor?
Yes.
Every time John overdrafts his bank account, he faces a $37 fee.
$37.
Yeah, doesn't take much for that to add up to quite a few dollars.
With 15 overdrafts, John pays $555 a year in fees.
Could that be the difference between making it and not making it for you financially?
There are times, yes.
He's far from alone. According to the Center for Responsible Lending, in 2015, U.S. consumers paid $17 billion in bank overdraft and non-sufficient funds fees. That's $53 for every American. And the fees just keep growing. Chase, U.S. Bank, PNC, Fifth Third, Key, and Huntington all dominate Ohio's banking landscape. Last year, according to FDIC reports that we studied, these 6 banks combined made more than $8.6 billion from fees charged across the country. More than $2.9 billion of those fees came from overdraft charges.
Banks are a business, and this is just one of the sources of revenue that they're receiving.
Mike Adelman, the president and CEO of the Ohio Bankers League, which represents all banks in the state, defends the fees as a service.
I think the average $35 fee for an overdraft is certainly much more beneficial than bouncing a check so my landlord doesn't receive my rent payment for the month.
So it's a service provided so you don't face things like eviction?
Correct, sure.
I traveled to Washington, D.C. to get a different take from Ed Merzwinski with the Public Interest Research Group, or PIRG, which has studied bank fees for 3 decades.
It's not only brilliant, it's devious, because consumers think they're being offered protection. Consumers think they're being offered convenience. But again, the cost of providing the service is about $1.50. They're charging you $35.
In this PIRG report, big banks, big overdraft fees, Merzwinski says overdraft and other fees are fueling the bottom lines for big banks.
They keep finding new ways to charge consumers fees. They invent new fees, they raise existing fees, and they charge more fees to people.
And according to government and banking studies, most of the bank fees that are fueling billions in revenues are falling on the backs of the poor.
People who pay bank fees have less money in the bank.
The Consumer Financial Protection Bureau found 18% of bank account holders pay 91% of all overdraft fees. Most of them, nearly 7 in 10, make less than $50,000 a year. And according to a survey commissioned in part by Bankrate.com, Americans with a bank account who had an annual household income under $30,000 paid $31 each month in bank fees.
Are we banking on the backs of the poor?
Absolutely. We're banking on the backs of the poor.
The Ohio Bankers League disagrees.
I do not agree with that at all. The fact of the matter is banks are a business. I think a lot of people forget that. And just like we pay a fee to the furniture company to deliver a new sofa, or we pay a convenience fee on top of the cost of purchasing sporting or concert tickets, there's some fees attached to some of our banking services.
But outside of the banks, my question,
Are we banking on the backs of the poor?
drew similar answers.
Yes, we are.
From the Childhood Poverty Collaborative
No question.
No question.
to a U.S. senator.
It's legal, but it shouldn't be.
Senator Sherrod Brown is the ranking minority member on the Senate Banking Committee, and he hopes he will soon be the chairman to make some changes.
If the Democrats are in the majority, I'll be chairman of the banking committee, and we're going to have a very different look at the way banks are able to do business in this country, and in terms of the fees they charge.
For John and many others who live on little income, any relief from bank fees could make the difference between making it through the month or not.
Do you think it's fair to charge these fees?
Well, I can understand, having fees, but they need to be reasonable, and they have gone way past reasonable. They're just out of control.
This is what democracy looks like! Hey, hey!
In Indianapolis,
Boy Scout Genius got to go!
diabetics, including a busload from the tri-state, converge on pharmaceutical giant Eli Lilly,
Medicines for people, not for profit!
protesting sharp increases in insulin prices, including Lilly's popular Humalog, a fast-acting insulin taken before meals.
When do we want it? Now!
Spikes in the price of Humalog and other insulin products made by Lilly and 2 other pharmaceutical companies, diabetics say, are forcing them to face deadly choices.
Go! Hey, hey! Ho, ho! Boy Scout Genius got to go! Hey!
According to the American Diabetes Association, the average list price of all insulin has skyrocketed in recent years, nearly tripling between 2002 and 2013. Adding, the reasons for this increase are not entirely clear. We asked for an on-camera interview with the company, but in a written statement, the senior director of corporate communications kindly declined, stating Lilly's last price increase for insulin was May of 2017, which she says has been Lilly's one price increase over the last 26 months. That May 2017 increase for Humalog was 7.8%, but that was on top of a 7.51% increase in 2016, and a hike of 16.98% in 2015, and 20.81% in 2014. According to the Union of Concerned Scientists, the price of Humalog has increased by 1,157% in 20 years, from 1996 to 2017. Lilly has offered as much as 40% discounts to patients who are having trouble paying, but has yet to answer our direct questions about why its insulin prices increased so much.
What killed your son?
Official cause of death was diabetic ketoacidosis. Unofficially, he died from corporate greed.
Nicole Smith Holt came from Minnesota to protest. Her son Alec died in 2017, just months after he turned 26.
He was no longer eligible for my health insurance.
Even though he was working, Alec could not afford the continuing cost of paying for life-saving insulin, including Humalog.
Well, he didn't have enough money in the bank to cover the $1,000 plus additional $300 for supplies. He started rationing his insulin. He was found dead 3 days before his payday.
All right.
A mother still grieves over losing her daughter, Antavia Lee Worsham.
I miss her.
Antavia was just 22 years old. She had 2 jobs, including working at the concession at Bengals games. It was not enough to pay the bills, and a high deductible meant Antavia had to pay thousands out of pocket for her insulin, including Humalog, before her insurance would begin to pay.
Roughly between $1,200 to $1,300 for again a 90-day supply.
$1,200 to $1,300.
$1,200 to $1,300. She couldn't afford her insulin. She rationed. When my son found her in her bed, she had a pen in her bed, but it was empty.
In its statement, Eli Lilly addressed that issue, saying, unfortunately, some people are provided high-deductible insurance plans, which require people to pay thousands of dollars before coverage begins. The official cause on Antavia's death certificate, the same as the cause of Alec's death, diabetic ketoacidosis, a buildup of acid in the blood that can be, and often is, fatal when a diabetic doesn't get enough insulin.
She died as much from poverty
Yes.
as anything else.
Yes.
Antavia's mom is now on a mission to change that for other diabetics, including her other daughter.
Because I'm also a type 1 diabetic.
And the cost of living on insulin is just as steep as it was for her sister.
Without it, what does it mean for you?
If I go without it, then I'm not here.
Alec's mom is on a mission too, from testifying in Washington.
And Alec is not the only one who has paid the ultimate price.
Price gouging has got to go!
To protesting in Indianapolis. She has one clear message for anyone who will listen.
Stop the greed. Start putting patients' lives over your profit.
Price gouging has got to go!
Okay.
You grew up in this house.
Yes, I did.
For Ralph Moon Jr., this house on Dayton Street is still home.
I kept it.
His West End neighborhood was once full of thriving African American families.
I didn't just know a person across the street. I knew their family, and their family knew me.
Working families.
You know, there was a work ethic.
Ralph's father, who owned a masonry business, worked hard.
If I got up at 5:30 in the morning and looked out of that window, every father was on his way to somewhere.
But Ralph's world, like thousands of other African Americans, changed forever when I-75 came through.
The cohesion of community, family, worship, school, neighborhood got completely devastated.
Pictures from the Cincinnati History Museum document hundreds of homes and businesses that were destroyed to make way for I-75. From the air, it's clear to see this highway divide. Dayton Street, where Ralph's old home is, was literally cut off from the heart of Cincinnati. Other streets in the West End suffered the same fate. Slowly, once thriving African American communities here began to decay. Driving down the interstate today, we barely notice Ralph Moon's neighborhood and countless others that were cut off 6 decades ago. While lots of people were displaced when these highways came through, data reveals Cincinnati has a notorious top spot in the entire country when it comes to one group impacted by the interstates.
Cincinnati had the worst impact on people of color in the country.
Yes, it had, for a large city, it had the largest impact upon number of families, and those families being African American.
Dr. Rob Nelson, the director of the University of Richmond's Digital Scholarship Lab, crunched the numbers of family displacement from urban renewal from 1955 to 1966, producing this remarkable map that visualizes the numbers as circles. The bigger the circle, the more people who lost homes. While more families were displaced in places like Chicago, Philadelphia, and New York, a click on Cincinnati reveals the Queen City was #1 when it came to the percentage of African Americans who lost their homes to the highways. Of the 6,713 families who were displaced when the highways cut through, 93% were families of color. The worst hit, Kenyon Bar, what we now call Queensgate, where 97% of the 4,953 families who lost their homes to I-75 were persons of color.
Were these communities targeted?
Yes. Getting rid of targeting some of these communities, that they might do that in the interest of seeing if they can promote integration, racial integration in their cities.
But integration, Dr. Nelson says, did not happen. Instead, the highways formed a great divide.
Using highways as barriers to buttress segregation, separating black communities from white communities, say, so they become a physical barrier, or running them through communities that are the most vulnerable.
And you believe most of what we're seeing today is rooted in that I-75 corridor?
I do.
Dr. Karen Bankston of Cincinnati's Childhood Poverty Collaborative says I-75 has left such a deep scar, even a new soccer stadium in the West End is greeted with skepticism.
So most of the distrust of any move by the powers within Cincinnati is rooted into the decision of building I-75.
I think a lot of it is. That's why people are so scared. That's what I do.
Because they lost everything haven't recovered?
And they haven't recovered.
You can't undo I-75.
The legacy of interstates,
well, the building's gone,
has left a void. gone,
Gone.
gone. All in the name of progress.
For who? Who progressed from this?
Somebody did.
Wasn't us.
I'm Dwayne Pullman, Local 12 News. From Columbine to Sandy Hook to Stoneman Douglas, deadly school shootings have forever shifted our view of school safety. But while these senseless slaughters have seared our senses, violence and threats of violence in our schools are far more common than most of us know.
The active shooter is the most obviously visible.
And it's the most rare.
Dr. Amy Klinger, a former teacher and school principal, is the co-founder of the Educators School Safety Network, which researches all school violence and threats of violence that happen every day, no matter how small.
A bullet was found, somebody was stabbed, there was a shooting, there was a gun found, there was a violent intruder from the outside that came in. Our numbers don't come from the schools. Our numbers come from media reports.
In its annual report, States of Concern, Dr. Klinger's group compiles those reports and ranks which states have the most incidents. After crunching the numbers from the 2016-2017 school year, Dr. Klinger's group found the number one state of concern for school violence and threats is Ohio, a fact that shocks even school administrators.
I did not know that Ohio was the top. That's surprising and scary.
Ohio's right there at the top. Why?
Good question. I don't know.
While states like Colorado, Florida, and Connecticut are often associated with school violence because of mass shootings, none are in the top 5 when it comes to overall school violence and threats. Ohio, on the other hand, made the top 10 list in all categories, including violent threats and incidents, and it has been number 1 or close to it every year since Dr. Klinger's group published its first states of concern 2 years ago.
We need to be doing things to keep kids safe, and we shouldn't delude ourselves into saying, oh, well, we've not had a big enough event to warrant being concerned about that. Tell that to the parents of the kids that have died in Ohio.
In the 2016-2017 school year, in Ohio's schools was 135. That's more than triple the number that Indiana's schools had, which is 40. And nearly 5 times the number in Kentucky's schools, which was only 24. And those threats and violence, Dr. Klinger says, are usually early warning signs for more violence to come.
I think what you saw, for example, in January, a kid makes a threat on social media in January, probably nothing happens. All of a sudden, Parkland happens.
To counteract the threats and violence,
when you say you're going to kill someone or you're going to whatever, we have to take that seriously.
Dr. Klinger leads seminars across the country.
There are a lot of educators that are not getting adequate training.
Teaching teachers and administrators how to spot and deal with all issues of violence and threats in schools before they become worse.
So sometimes it's really obvious, but most of the time it's not.
But mass shootings still dominate the discussion, like here at a meeting of the Rotary Club of Northeast Cincinnati, where local superintendents talked about new ways to handle active shooters by installing door stops.
And in one stop, you drop this bracket in, and it keeps anybody from being able to get into your door. So
even setting up machines to do automatic background checks.
They have to submit their driver's license, and it automatically does a background check on them.
And yes, answering questions about arming teachers.
Agreed, our school board and our chief of police are not in support of that strategy.
While the debate about arming teachers and dealing with active shooters are important, Dr. Klinger says they should not be a priority.
It's a distraction that will get us nowhere, because you will never get those two sides to agree. But yet we can agree on so much. Violence prevention, threat assessment, identifying individuals of concern, making sure our facilities are safe. I can give you a grocery list of 20 things we can be doing that literally everyone could agree on, regardless of your positions on guns.
Ironically, Dr. Klinger says most of the issues of violence in our schools can be addressed through education itself.
Do you think we can solve it?
School safety? Absolutely.
Well, we don't have any training. That
We
is
just have to have the will to
substantive.
do it.
All right.
Hop up there, Dwayne, if you want to take a look.
At this massive marijuana grow facility near New York City,
Holy cow. Whoa.
thousands of marijuana plants grow in greenhouses.
This is a lot of marijuana bud going on here.
Yeah.
Each plant is nurtured
All of it's like precisely monitored here.
to produce
That seems like a lot of buds per plant.
huge yields.
That's what we're shooting for.
PharmaCann, a Chicago-based company that will soon be operating a grow facility like this in Ohio, has been cashing in on cannabis for years.
How many buds are in this room?
768 times that 150.
That's more than 115,000 buds. In another section,
This is the extraction facility.
to get oil.
It's about 70% THC.
That's worth a lot of money.
250K, 500K, 500K, 500K.
So $1 3/4 million here.
Something like that, yeah. Give or take.
That's mind blowing.
That oil is at the center of a wide range of medical marijuana products. By law, those products are stored in here.
And behind this door in this safe, tens of millions of dollars worth of medical marijuana products.
Security here
You got to card us in here.
is tight.
We're being watched.
Yeah, there's security cameras in every room.
A series of sophisticated cameras connect to monitors.
From the greenhouse all the way to the end, you're on camera.
308 cameras in all, providing 360-degree views of every inch of this massive facility. Playback proves we were always in focus.
So you've been watched since the minute you walked in the building.
On the outside walls
is our intrusion detection system.
A series of sensors that can tell the difference between a touch and trying to cut through.
Those are actually going to tell you if that wall has been cut.
Yeah. But the key to preventing theft begins and ends with this barcode. Every plant carries one.
Tracked.
Every step of the way.
The whole way through?
The whole way through.
If even one plant is missing, they'll know.
If somebody wanted to get to the marijuana,
They'd do something other than break into this facility.
Jeremy Unruh, one of the founders of PharmaCann, says the high security here is required by law.
the security level here with the cameras and all that's going to be in Ohio as well?
That's right, same footprint.
Really?
Yeah.
In Arlington Heights near Chicago, security is just as tight at this dispensary owned by PharmaCann. The medical marijuana is in the back behind these glass doors.
But because we don't have one of these, we can't get in there.
Everything's locked up, cameras everywhere. You got a key in every different room.
And the security system here is intelligent.
This camera can capture license plates. That camera can capture your face before you walk in the door. And when you get inside, dozens more cameras, all searchable by face. More cameras in here than a bank or a pharmacy.
And the medical marijuana products continue to be tracked using that barcode.
These seed to sale tracking systems are our inventory control, our anti-diversion system.
That's another word for anti-theft. All this security may seem like overkill, but it's all required by law, including the new laws that will control the marijuana here in Ohio.
If the policymakers want us to have super secure facilities like this, then we're happy to give them that.
While the security measures
in the quiet northwestern Ohio village of Rockford, population 1,200, corn is king. But marijuana is now making its mark here too. Thanks to 16 drug-related charges filed against Glenn Keeling and 15 charges filed against his wife, Peggy Kimmel.
They've told us that we're criminals.
Are you criminals?
No.
Are you bad people?
No.
It all began at the couple's home on October 31st.
Halloween night.
Someone knocks and you open it, right?
Yeah, I did.
What'd you see?
About 11 cops.
Those officers had a warrant to search for drugs.
Did they say what they were doing here?
They were here to take my drugs and guns and anything else that I had in the house that I wasn't supposed to.
Were you shocked?
I was.
Glenn suffers from Crohn's disease, and his doctor recommended marijuana as the best medicine.
Did it help you?
Yes. I was able to eat better. I had more of an appetite. I was able to get out of bed.
So when Rockford police officers and Mercer County Sheriff's deputies came, Glenn says he led them straight to his marijuana.
So I just gave him everything. It was like, well, here's everything I have.
But when he tried to show his medical marijuana card issued by an Ohio doctor, it didn't matter.
I said, well, I have a medical card for what I have. And he says, well, there's no medical program in Ohio. I don't care about your card.
They didn't care about Peggy's card issued by the same doctor either.
I said, what is going on? I don't understand.
Peggy suffers from multiple sclerosis. The marijuana, she says, was a miracle medicine.
I could walk without using a cane or a walker.
Recommended by a doctor, marijuana had replaced countless pills, shots, and other pharmaceuticals that a biopsy revealed were harming Peggy's liver.
I was scared to death because I thought if you don't have a liver, you'd just die.
Peggy's 14-year-old daughter, Tina, watched as marijuana helped her mom improve.
My mom could walk.
Tina was awakened by police. That night, they came into her home.
What do you think about all the police coming in and doing this?
I was scared. I didn't know what was going on.
Among the charges Peggy and Glenn face, a count of child endangering. Even though Mercer County Child and Family Services stated that the family has many strengths, including a desire to protect Tina and provide for her basic needs when it closed the case.
They feel that she is safer with us than anywhere else.
But safety has been shattered for the entire family. That night, the police came.
I ended up leaving with them.
In cuffs?
Yes, in cuffs.
I reached out to the prosecutor, Matt Fox, to discuss the case. He sent files, but declined to comment.
All rise.
On June 13th, we were in the Salina courtroom as Peggy and Glenn faced a judge. Prosecutor Fox argued that their bond be conditional on drug testing.
They consume no alcohol or drugs of abuse and subject themselves to random testing.
Peggy's attorney argued marijuana is essential medicine.
Over the past few months, there have been an increasing number of lesions on her brain. Using of the marijuana tends to alleviate some of her suffering.
And in a surprise move, the judge agreed, issuing bond conditions that include use of medical marijuana. Now, paperwork is posted at the same door police walk through on Halloween night to advise anyone who enters that Peggy and Glenn are legally using medical marijuana, even though they're still facing serious charges for doing just that.
If you could say one thing to this prosecutor, what would you say?
I'm sorry that he thinks I'm a criminal. I did not knowingly do anything wrong. I am not a criminal. I am afraid so bad I would not ever break the law on purpose of any kind.
The Lytle Tunnel.
It's one of the only tunnels in Ohio.
It's a crucial connector for I-71 through Cincinnati, now lit by a lot of new LED lights.
There's 1,317 lights in all three tunnels combined.
The 5,000K fixtures are bright and white, but ODOT says they're nowhere near as bright as they were.
We got control of them.
Last year, I, like many of you, drove through the tunnel. The lights were overpowering. producing something the American Medical Association describes as a disability glare, an impairment that an AMA report called a veil of illuminance, which leads to worse vision than if the light never existed at all.
We had the initial growing pain of the bright lights, but now everything's done, everything's back to normal.
That normal was achieved by installing new technology. ODOT agreed to give me an all-access tour deep into the bowels of the new tunnel.
Look at this.
To show me this.
And this is the only lighting system on ODOT's system that has this ability right now.
A new cutting-edge control center.
So right here is the brains to keep the lights from having the dangerous glare.
Yes.
These computers are programmed to match the tunnel's light to the level of light outside.
It's not too bright.
It's not too bright. It'll be at the correct brightness for when you're coming in and going out, so you'll be seamless almost.
That almost seamless lighting transition into and out of the tunnel, ODOT says, is achieved using these light sensors.
But what we have on each end of the tunnel is luminance sensors.
The sensors tell the computers when to turn the lights on or off.
Because it tells you that, you know where the point where it's good and where it's not so good.
Or when we need to make them brighter or make them good.
Bright during the day, dimmer at night, all to reduce that dangerous glare.
So you don't have that quick adjustment and you don't get that blinded feeling.
The cost of the new lighting and all those controls isn't cheap. $2 million, but ODOT says it's worth it to keep people safe.
And you can see if you look left and right down through here, this is much, much better than it was before.